cystitis is a very common bacterial infection.
Because of how common it is, some people might end up ignoring it, and which is the worst you can do for yourself.
Yeah.
Recognizing the symptoms early and understanding triggers will make all the difference to treating cystitis.
Welcome to Consultation Room Podcast.
Today we're going to be talking about something that's pretty much uncomfortable, annoying, and honestly kind of a pain, and I mean it literally. So today we're talking about cystitis. So we're going to be breaking down what cystitis is, what causes it, how to deal with it, like going through the treatment, and better yet, how to prevent it. So stay with us, let's get into it. So Trudy, what is cystitis?
So cystitis is a medical term for a bladder infection. So most people will come in and they'll say, I have a bladder infection. That is what cystitis is. And it's normally, as we said, bladder infection. So it's inflammation of the bladder. And it's often caused by urinary tract infection due to a bacteria, which is quite common, which is E. coli. Now, not to mean that other bacteria can actually cause cystitis. Other bacteria can also cause cystitis, but E. coli is, the main culprit when it comes to cystitis. And most cases are mild and treatable, but normally if left untreated, it can lead to more serious kidney infection. So we should never ignore cystitis or, what I said, a bladder infection. Now, cystitis is mostly common in women. So mainly women will have cystitis, not to mean that only women will have it. I mean, we'll get into that, who can have it, who can't have it, or, basically what this is all about. But I think the most important thing to note is that it actually can be self-limiting. So it's not a very serious condition, but it can get serious. Just talking about, what exactly this bladder infection is, bladder inflammation, what are the other symptoms, Steph, when it comes to cystitis?
Yeah. So if you have pain or it's stinging when you pee or any burning sensation, that could mean that you have cystitis. Other symptoms of cystitis may also include when you need to pee more often and actually even urgently than usual. If your pee is also dark, cloudy, or strong smelling, it could mean you also have cystitis. But it's not always the case. Sometimes you don't have these symptoms. Sometimes some patients may also feel pain in their lower down, like in the tummy. So that could warrant an investigation if you're feeling that way. Other symptoms may also include high temperature, but this is usually found in children actually. But if, let's say for instance, you suspect that a child has cystitis, please see a doctor, your GP. If a child has cystitis, some of the other symptoms they may experience may include maybe wetting themselves, or they may have like reduced appetite, or even being sick, or sometimes even feeling very weak and irritable. So if you suspect your child has these symptoms, please see a GP. It could mean that they have cystitis. In old, frail patients, especially with like cognitive impairments such as like dementia, and people with like urinary catheter, they may have symptoms such as like change in behavior, or even feeling confused or agitated. And also they may experience some wetting themselves more than usual as well, or even shaking or shivering. But the main symptoms when it comes to cystitis is basically the pain and burning sensation when you do pee, and the frequency and urgency of the peeing. But these are the symptoms of cystitis. Who can get cystitis, Trudy? who's more prone to getting cystitis?
So as we said, women and unfortunately are more likely than any other group to get cystitis. And this is for the simple reason that, our physical anatomy is different from, say,
Yes.
men and from children. So women have a shorter urethra, and that means that the bacteria actually has not too far to travel to get to the bladder. Hence why women are likely to be the ones to get cystitis more than, say, men. So women, any woman is likely to get cystitis. I can count in both hands how many women come into the pharmacy in a week, every week to get something for cystitis. So it's very, very common in women. Now, if you're sexually active, unfortunately, you are also likely to get cystitis. Now, again, this is for the simple reason that, during penetration sex, it can push the bacteria back, all the way up to sort of the bladder. So women who are sexually active are even more prone to cystitis than maybe other women. So if you're sexually active, you are likely to get cystitis. Also, pregnant women, unfortunately, due to hormonal changes, so pregnant women can actually are very likely to get cystitis. I don't know, Steph, you have carried 3 boys. Have you had cystitis during this period?
No, luckily enough, I was okay. I mean, they checked it all the time when I saw my midwife, so I was okay.
Yes.
But as you said, it is very common. Like I do know certain people who actually experienced it during pregnancy. Yeah, so it is very common in pregnancy. Yeah.
Okay, that's brilliant. You're lucky, touch wood,
I know.
Well, I don't know how many more you have planned, or this is it, but
this is it.
if you're planning any more, touch wood, it stays that way. So pregnant women are likely to get cystitis. I know for sure when my sister was carrying one of my nephews, she actually had really, really bad cystitis. So it is quite common in pregnant women. And talking about hormonal changes, menopausal women are also very likely to get cystitis. So I don't know about you, Steph, but actually in the pharmacy I tend to see more older women come in for cystitis treatment as opposed to younger women. Again, this could be an explanation, but again, it could just be the demographic. But yes, menopausal women are likely to get cystitis. Again, part of it is because of the hormonal changes.
That's right.
Another group that is likely to get cystitis is actually people who are on certain birth controls. So if you use like the diaphragm, which has got, I think, spermicide, so that is likely to cause you to have cystitis. So if you're on certain birth controls, you can get cystitis a lot more frequent than maybe other people. So if you are actually getting cystitis quite frequently, I would advise maybe you just check with your healthcare provider, maybe your GP, your birth control, and just see if maybe that is what is causing that, and then maybe see if there's any other options for you. Another group that is likely to suffer from cystitis or is at risk of cystitis is anyone who's on certain medication. So mainly people who are on chemotherapy. Unfortunately, because that can cause inflammation in the bladder, which again we said any inflammation in the in the bladder can cause UTIs or cystitis. They are likely to get cystitis. So people who are on chemotherapy or radiation therapy, they are likely to get cystitis. Another group is anyone who's immunocompromised. So if, say, they have HIV or any conditions that might compromise the immune system, they are likely to also get cystitis because, again, there's not anything, or basically the body is not able to fight some of the bacteria, which normally the body would be able to fight. So these are the most common groups that could get cystitis. I don't know if there's any that I haven't mentioned, Steph.
No, I think you've pretty much like listed all of them. I'm not sure if you mentioned, I think diabetics as well.
Oh yes, so yeah,
Yes,
I didn't actually mention that. Yeah, but yes,
yeah.
that's true. Yeah,
Yeah, diabetics as
people are
well. So
diabetic. Yeah.
yeah, prone to getting cystitis.
Yes,
Another group of people who I was thinking is probably like male patients with like enlarged prostate glands or
enlarged prostate.
something.
Yes, or anything that
Yeah,
prevents the flow of urine, I
you're
suppose.
yeah, exactly,
Yes, so
exactly.
kidney
Yeah,
stones, things
kidney
like that,
stones.
enlarged prostate.
Exactly.
Yes.
Yes, yes. So those are the only ones I would add to it. Yeah. Mhm.
Brilliant, perfect. So if you're within these groups and maybe you have realized that you are having recurrent cystitis, maybe it's worth having that conversation with your doctor just to
Yeah.
see if there's some things that you can change. So when it comes
Mm.
to, as we said, some birth controls, there is normally other options. So you can just see
Yeah.
what there is available. Or if maybe you have a kidney stone and this is causing you to have, recurrent cystitis, maybe speak to the doctors and see if there's any way they can, help manage or even maybe just get rid of the kidney stone, things like that. So
Mm.
if you're within these groups and you have been getting recurrent cystitis, have that conversation with your doctor. Not to
Yeah.
mean that anyone who's not within this group cannot
Mm.
get cystitis or is not at risk of getting cystitis. As I said, it can happen to anyone, but mostly women, unfortunately, because of what we mentioned. Well,
Mm.
speaking of, so someone's got cystitis and they've got all the symptoms you've listed.
Mm-hmm.
And what do they do? Is there any treatment? Is there any
Mm.
remedies, any home remedies, any over-the-counter
Yes.
treatment? Is there what can they do?
Yes. So when it comes to cystitis, luckily enough, yeah, there is treatment. Although we have said that it is self-limiting, like so it will
Yes.
go after a couple of days. But there are treatments you could go for. As Trudy mentioned, there are home remedies which I love.
Yeah.
Yeah, we'll get into that. So some patients, when they do notice they have cystitis and it's not going
Yeah.
away, they do go see their GP. And what the GP might do is that your GP might offer you some antibiotics, and which you
Yeah.
may take for like a couple of days, like 3 days or so. Sometimes the
Mm-hmm.
GP might actually advise you to hold off on taking the antibiotics and maybe take it
Yes.
48 hours after receiving the prescription, because as I said, it is a self-limiting condition. So maybe after
Yes.
48 hours the symptoms may reduce or even go away, so
Yeah.
you may not need to take the antibiotic. But yeah, so antibiotics is mainly what the GP will give you. Sometimes they do offer some patients some painkillers as well, and basically just some
Mm-hmm.
self-care advice, which I will get into it. But painkillers, because as we said, you do experience some pain during like peeing, so they offer some painkillers to ease that pain.
Yeah.
Yeah, and if, let's say, for instance, you have like recurrent cystitis, which does not go away, the
Yeah.
GP might offer you some low dose antibiotics, which you may take for longer than 3 days, sometimes even several months,
Yes.
Um, if, let's say, for instance, your cystitis is triggered by sex, they may offer you antibiotics which you need to take within like 2 hours of having sex, or
Yes.
if you've noticed sex is your trigger, that's what may happen. Or sometimes they may offer you some vaginal estrogen cream
Yeah.
if you have gone past, like if you've gone through the menopause stage, they may offer you some vaginal estrogen cream. But if, let's say, for instance, before going to your GP, you want to tackle cystitis by yourself, yes, as I mentioned, there are some home remedies which you may be able to use. So, what they have found is that products containing cranberry
Yeah.
actually do help with cystitis. So, what happens is
Yeah.
that I think cranberry prevents the bacteria from attaching the bladder walls. So cranberry is quite good if you have cystitis. But
Yeah.
if, let's say, for instance, you're on a medication such as warfarin, I would say please do not take the cranberry products without consulting a pharmacist or a GP, because cranberry can interact with warfarin. So please, before you take cranberry products, speak to someone else, speak to a
Yeah.
pharmacist or so. Yeah. Um, again, yeah, if you're treating it at home by yourself, so painkillers, as we said, so like paracetamol to ease with the pain. Drink plenty of water. Hydration is actually key when it comes to cystitis, because
Yeah.
what I usually say is that when you drink, it kind of like washes away the bacteria. So
Mm.
hydration is key. Drink plenty of water. If you can, even go over the 2 liters that you're required, it would really help. But that would
Yeah.
mean that peeing more often, which is quite good actually when it comes to
Yeah.
cystitis. Make sure you're peeing frequently. You don't want to hold it in. Yeah. Okay.
No.
Um, yeah. So if you are also experiencing some pain, maybe do some hot water bottle, which I really do prefer, especially even when I have like period
Yes.
pains and stuff. It really helps. So
Mm.
if you're having any pain if you have cystitis, do that. Get that fluffy hot water bottle, put it on yourself. That should
Yes.
help lower the pain in your tummy. Yeah. And as I said, if your cystitis is also triggered by having sex, please avoid sex. Make sure it goes away before you actually do have sex. And what we've actually found is that some drinks can actually trigger cystitis. So the way to treat it is basically avoiding certain drinks that irritate like the bladders, for instance, like fruit juices, coffee, or alcohol, because these may actually be making your cystitis worse. So please, if
Yeah.
you have cystitis, one way to help yourself to treat yourself is avoiding these drinks. Yeah. And yeah, so these are the main things. So make sure if you have cystitis, take some painkillers to help ease your pain, cranberry products, but make sure you consult the pharmacist first before buying that. And if
Mm-hmm.
these are not helping, please see a GP so that they'll offer you some prescription of antibiotics. But apart
Yeah.
from that, hygiene and basically avoiding the triggers is the way of basically treating cystitis. Yeah.
Yeah.
Is there anything you want to add, Shruti?
I'd like to just add something. You've
Mm,
mentioned cranberry juice with warfarin, but I think
yeah.
I'd like to just mention that any blood thinners. So if you're taking any blood thinners,
Mm,
I would advise that you avoid taking cranberry products or cranberry tablets. Speak to the doctors before taking some of these things. So any
yeah.
blood thinning medication, if you're on any blood
Yeah.
thinning medication, it's very, very important not to just jump on the cranberry because, as you said, it can interact with the medication. It can cause bleeding,
Mm,
and that's the last thing you want. And I think you mentioned something when it comes to... Oh, I forgot my point there. But yeah, I'll probably remember in a minute. But yeah,
yeah.
no, you mentioned something and I kind of wanted to add on, but no, I think you've
Mm,
said that, very, very well in terms
mm,
of like the treatment. Oh, yeah. So
yeah.
when it comes to antibiotics, I think it's very, very important that you finish the full course of your antibiotics. I can't emphasize that enough because what I find is, so mostly patients who have cystitis are put on, 3 days course of antibiotics.
Mm,
And most of them, because it is self-limiting, so it will probably be,
yeah.
you might start taking it when it's sort of starting to sort of clear. And then after the first day, you're like, look, I'm actually, I'm not feeling, the symptoms anymore.
Mm,
And you stop taking it. And that is the
yeah.
worst you can do for yourself. It's very important when it comes to antibiotics, not just for cystitis, but generally when it comes to
Yeah.
antibiotics. It's very, very important to finish the full course
Yeah.
of your antibiotics. Never stop halfway because you're starting to feel better. Never, miss a dose because, I can't be
Mm,
asked. No. It's very important when it comes to antibiotics to finish the full course of your dose,
yeah.
of your treatment. But otherwise, you've pretty much mentioned everything else
Yeah.
there is when it comes to
Yeah.
treatment.
Well said about the antibiotics, because I think a lot of patients tend to do that once they feel like, oh yes, I feel better now, like,
Better,
I don't need to continue with like the antibiotics.
yeah,
But yeah,
because
it's best to finish the course just to make sure that you've gotten rid of all the bacteria in your yeah, in
exactly.
there.
And that's why I don't understand when people have leftover antibiotics. I'm thinking, how do you have
Mm,
leftover
how do you,
antibiotics? Did you not
yeah,
take your full course of antibiotics? So
exactly.
honestly, I can't emphasize that enough. Maybe we'll have an episode
Mm,
on antibiotic resistance because it's very
yes.
important. And I think it's a conversation that people need to to know about, because there is something called antibiotic resistance, and that's what happens normally if you're not taking antibiotics correctly, you're not finishing a full course of antibiotics and things like that. But yes, I think, that point is very, very important, just knowing that they need to finish the full course of antibiotics.
That's right. That's right. Fantastic. So along the way, I have mentioned a few things to help us prevent like cystitis, but do you mind just going into details like how someone can prevent themselves from having cystitis or even recurrent cystitis?
Yes, of course. So when it comes to cystitis, first and foremost, Steph, you have emphasized on water, fluids. That is literally my first point. For you to prevent cystitis, you have to make sure you're drinking enough fluids, especially water, not just your everyday coffee, tea, flavored tea, no. Make sure you're drinking as much water as possible as well. Because one of the reasons actually that people get what I like to call an infectious cystitis is lack of enough hydration. So this can actually cause cystitis. So one way to prevent cystitis is to keep hydrated. So make sure you're drinking your fluids, make sure you're drinking your water. As you said, Steph, if you have to go past your 2 liters, if you have to do, 3.5, 4 during certain periods, by all means go for it. Especially when you're taking certain medication or when you're going through some of the things we've said that can actually cause you to have cystitis. I think it's very, very important to keep as hydrated as possible. Another way to prevent cystitis is to urinate when you need to. Okay, so holding your pee is actually one of the worst things you could do to yourself, because what's going to happen is you can actually cause this inflammation in the bladder, and that can cause cystitis. So if you need to pee, go pee. Don't hold your pee. My boyfriend says something to me, and my fiance, says something to me normally, and I'm constantly like trying to correct him because he thinks I've got the smallest bladder. So I can't normally, like, if I drink something, I'll almost immediately want to go pee. And he's always like, no, you need to start training your bladder. You need to hold it. And I'm thinking, no, if I hold it, I'm going to do myself more harm than good. Exactly. So that is a thing that people have, that you're training your bladder, but actually you trying to train your bladder is what is going to cause you to have cystitis. So if you need to go pee, go pee. Please don't hold your pee. Don't be like, okay, I need to train my there's no Olympics, okay, bladder Olympics here. So if you need to go pee, go pee. That will be one of the ways that you can actually prevent yourself from getting cystitis. Another very, very important thing to note as well is, especially for girls, when you are doing your number 2, always wipe from the front to the back. That is very important. And I don't think it's a lesson that we actually get taught, even growing up. I don't know, maybe it is, maybe I just wasn't taught this. I've never had cystitis, touch wood, but I feel like this is something that needs to be mentioned to girls, just growing up, like, make sure you're wiping from front to back. Make sure you're wiping from front to back. I have seen a video, Steph. I don't know if you've seen this video of this dad. He was showing his 2 little girls how to wipe. Yes, and I think this is quite clever, and it's he probably doesn't even realize that he's actually preventing a lot of infections, not just cystitis, but a lot of future infections by just doing this or teaching the kids this simple method of actually wiping. So wiping from front to back is very important, because what happens is sometimes if you maybe wipe from back to front, you're introducing that bacteria to the urethra, and then it will go up the urethra into your bladder, and you will end up getting cystitis. So it's very important to wipe from front to back. Can't emphasize that enough. Also, another very important way to prevent cystitis is to take showers as opposed to baths. Now, I am a shower girl through and through. Like,
same.
If I had to pick, I'd always pick a shower. Some girls cannot even take a shower. They have to take a bath. I don't know about you, Steph.
No, I love my shower. Oh,
You like your
love
shower.
it.
Exactly. There's just something about the
Yes.
water dripping on you, and then you
Oh,
can
it's
see,
so
especially if
soothing.
you've lathered your
Yeah.
body and then you can just see it go down. It's nice. Like,
Yes.
it's lovely. It's just lovely to see that you've kind of washed
Yeah.
off everything.
Mm-hmm.
So unfortunately, some girls, or majority of girls who will take a bath, are probably the ones who might have cystitis, for the simple reason of, when you're taking a bath, you have all this, all kinds nowadays.
Products.
There's the bath
Yeah.
bombs, there's this,
Mm-hmm.
lather soaps, there's all of these things,
Mm.
there's the fragranced, I don't know, things that you have to put in the water. And all of these things is just going to sit on your genitals, and it can
Mm-hmm.
actually confuse the pH down there. And that is
Yeah.
how bacteria will easily travel up the urethra and cause you to have cystitis. So I'm not saying don't take a bath by all means, but if you take frequent baths as opposed to showers, you are actually more likely to get cystitis,
Yeah.
especially if you're using a lot of products in this bath. It's very, very important that you take baths that's not too concentrated and things like that. But
Yeah.
definitely taking baths over showers is one of the ways that you can actually get cystitis. So preventing this would be taking showers over baths. Speaking of, if you use hash products to wash, if you use like very highly fragranced soaps, highly fragranced, shower gels and all of these things, and you're washing down there with some of these things, this is what can cause you to have cystitis. So it's very, very important that you use as mild a product as possible to wash, especially down there, if you have to use any, really, because honestly, we always say just water. Good old water is all you need to wash down there. You don't need to be going in there with vanilla flavored, shower cream, or or jasmine flavored whatever, or jasmine,
Yeah.
Honestly, all of this is not necessary. And I know sometimes girls are like, oh, I need to spray down there. No, you don't need to. You don't need to. We have had this conversation before, and we can't emphasize on this enough. Your lady does not need, your little flower does not need all of these extras, okay?
No.
Just good old water is all you need to wash down there. By all means, if you want to wash the rest of your body with like all these nice smelling, nice fragranced whatever's, go for it. But when it comes to down there, it's very important just to use very mild products. If you have to use any, but at least you just soap and water. No, water and a nice little cloth is all you need. Just make sure it's soft as well. So don't be harsh as well doing washing down there, because some people are harsh. When they're washing the flower, be gentle. So that is very, very important. And also what I'd say is after sex, it's very important, especially if you have recurrent cystitis. After sex, just empty your bladder, because as we said, if during penetration you're pushing this bacteria up, if you urinate or anything like that, you're almost like getting rid of this bacteria. So it's very important to empty your bladder after sex. Just generally, really, I mean, this is a way to prevent it. So just generally after sex, it's very, very important to empty your bladder, but especially if you have recurrent UTIs. But I think that's everything when it comes to preventative measures, unless there's anything I haven't mentioned, Steph.
No, you've gone through it extensively. These are what I would literally advise everyone as well. So you've already said it, like mostly when it comes to hygiene, just do the basics, water, don't overdo it. And then, as you said, a lot of like hydration as well, those are the main things. But nothing else to add. Yeah.
Perfect. What I'd like to just add when it comes to treatment or prevention, really, is very important if you have cystitis to treat it as soon as possible, because normally long-term infections infection can actually cause a lot of complications. As we said, complications of the kidney, and even it has been known to cause bladder cancer, especially in people over 60. So if you have cystitis, get it treated as soon as possible. If you have long-term cystitis, make sure you're talking to GPs, make sure you're talking to healthcare providers, find a way to, to treat this long-term cystitis, but don't ignore it. I think that more than anything, that is very, very important to emphasize on that. We always talk about myths when it comes to pretty much most conditions. So what have you heard, Steph, when it comes to cystitis?
I think it's pretty much like our normal conversation when it comes to like things down below. So when it comes to cystitis, I think one of the myths I've heard is that it's due to poor hygiene, and because they hear urine infection or there's something going on down there. But obviously this is a myth. Hygiene does play a role, as we have mentioned, but cystitis is actually caused by the E. coli, which Trudy has already mentioned. So it's from our own body, from the normal normal bacteria from our body. So even people with like excellent hygiene can get it. So just because someone has cystitis does not mean that they have poor hygiene. So that's like one thing. I think a lot of like the myths we have like debunked them, like before, like a lot of people used to say cystitis only happened to like women, and men do not get it.
I've heard that quite a few times.
Yes, so that we've already mentioned. And also I think one that I used to hear a lot was that cranberry juices cures like the cystitis. As I have mentioned, yes, cranberry products may help like prevent some of like the UTIs by making it harder for like the E. coli, the bacteria, to stick on like your gallbladder. But they're not a cure. It's basically a way of like minimizing like your symptoms, but you will like you will still need like antibiotics if like your preventative methods and your other stuff are not working. So drinking cranberry juices or any other cranberry products will not cure your cystitis. But those are the main one I've heard. What have you heard?
I think, as you said, we have debunked a lot of them along the way, which not mostly, I think the most and the biggest is that it only happens to women, but we have obviously talked about that, and we have clarified that it's not just women who will have cystitis. Men can also have cystitis.
That's right.
Older people, men and women can have cystitis. Even children can have cystitis, but it is more common in women for reasons we've mentioned. But that is one of the most common myths when it comes to cystitis. I think the only other thing I've heard is that it's an STI. People are like, oh my God, is this an STI? Like, especially from like, say, younger girls, they're like, have I got an STI? Like, I keep, I have this pain when I'm urinating, it's stinging and whatever. And then we go through all the symptoms. And then I say, oh, that sounds more like cystitis. And they're like, oh, is that an STI? That is an STI, isn't it? That is a myth. Okay, as we've said, it is caused by a bacteria. An STI would have to be something, I mean, there's some STIs that's caused by a bacteria as well, but definitely this is not classed as an STI. It is not. It is not a sexual transmitted disease. You won't get it because of having sex. You can get it due to sex, as we said, because of reasons we've explained. But that is not the reason that this would be transmitted. It can be, it doesn't, I mean, there's not transmission when it comes to cystitis. You don't touch the fluids of someone with cystitis and get cystitis, or have sex with someone with cystitis and get cystitis. It doesn't work that way. So that is certainly a myth. But just one thing you've mentioned earlier, which is, and I just want to clarify it, which is that cystitis is not a sign of poor hygiene. That is the correct statement. It's not a sign of poor hygiene, but poor hygiene can actually cause cystitis because of the bacteria. If you're harboring bacteria, and unfortunately, as women, we tend to harbor bacteria around sort of our genitals. So if you're not cleaning enough or cleaning well enough, that bacteria can find its way of traveling up the urethra and into the bladder and causing you to have cystitis. So poor hygiene can be a reason why you have cystitis, but cystitis is not an indication of poor hygiene, if that makes sense.
Yes.
Okay.
That's
Okay.
right.
Just making it known out there. I'm not that because the last thing I want is people saying, "Oh, you said if I have poor hygiene, I won't get cystitis." No, clean up, girls. Okay, take your 2 showers a day if you have to. Clean up, because if you don't, you will get cystitis. But yeah, that's all I've heard. I've not heard any other myths. But by all means, if you have any questions or you have any concerns about cystitis or just anything you've heard about cystitis, you're thinking, wait, is this true? Please let us know, because we would love to know these things and would love to talk to you about these things and maybe share these things with other people who might have the same feeling.
That's brilliant. So we have been through a lot, but quickly, let's say for who should go see their GP, or like if let's say for instance their home remedies or like the over-the-counter products are not working, who should see their GP?
I would normally say, first of all, actually, if you're an adult and you have, say, fever, chills, nausea, vomiting, even though, as we said, it's self-limiting. So during these 3 days or however many days you want to wait before you see your GP, if you're having these symptoms alongside, of course, everything else we've mentioned when it comes to your pee stinging, pain when peeing and all of this, I would go to the GP straight away. So that is one of the groups I would refer to the GPs. And also, if you have blood in your urine, that is normally, as we always say, blood in the urine is not really a good sign. Not to mean that it is, it is like the worst that could happen. But if you notice blood in your urine, by all means, this is a sign that maybe you should see your doctor. They need to do some tests just to make sure there isn't anything else that is underlying. I think those are the 2 groups I can think top of my head. Especially when it comes to people who have maybe not sought treatment. But if you've had the 3 days worth of treatment and maybe that's not worked, and I don't know, you feel like maybe it's getting worse, it's not getting any better, that is of course a reason to see the GP. What other groups are you thinking of, Steph, when it comes to referring to the GP?
I think it's so important you mentioned the blood in the urine, like anything to do with like blood, if you see it, I think it warrants like a GP referral. But the other groups of people that I would include, let's say if you've already mentioned, I think if your symptoms have not improved after taking like the 3-day course of like the antibiotics, and please make sure that if you have finished the course, because if you haven't finished and you're still having the symptoms, it's because you haven't finished them. But another group of people who I would say they need to see their GP. Let's say, for instance, you're having frequent cystitis symptoms, like you keep getting it. I would say, please see your GP, because they may need to do further investigation to find out what's going on. Also, I think you mentioned like if you have like some other symptoms such as nausea and stuff, but also if you have like a lot of severe pain in your lower abdomen, please see your GP. If let's say you're pregnant or you're a man, because these are less, like, if you're a man, it's less common for you to have cystitis, as we have mentioned. So if you are a man and you do see yourself having symptoms of cystitis, or you're pregnant, anyway, when you're pregnant, they will be checking like that you have urine infection. But these 2 group of people, please speak to your GP if you do have any symptoms. And as I mentioned earlier on as well, if a child is suspected to have any symptoms of cystitis, please speak to your GP. But if you are also an adult with like changes in your temperature, let's say for instance you're getting high temperature, or you're even having low temperature where you're shivering and stuff, please, again, this warrants you to see your GP. And I think I mentioned earlier on as well where some old patients, like fragile patients, they may feel confused or drowsy. That also warrants you to see your GP. But it's not just for old people, even for adults or anyone. If you're feeling drowsy, you're having difficulty in speaking or confused, please, 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 even not even see your GP. It might warrant an urgent GP referral, or even like,
Yeah.
NHS 111,
Yeah.
But those are the main group of people that I would say they need to see their GP. Otherwise, please
Yeah.
come to the pharmacy and speak to us, and we will help you find a product or
Yes.
like a medicine to help you. Yeah.
Yes. And I
Yeah,
think it's
but
also
this.
worth noting that now with the pharmacy first, there is
Yes.
treatment for UTI that you can get in the pharmacy. So we are trained now to treat UTI, unless of course it is,
Yes.
some of these groups that we would maybe call complicated cases that you might, just get the extra checks, which we can't do in the pharmacy. So if you are suffering
Yeah.
from cystitis or you're having some of these symptoms, come speak to us. We are qualified personnel. We will give you the right treatment, and we'll
Yes.
make sure, we basically try and make sure that we get rid of this of
Yeah.
cystitis. So always come to the pharmacy first. We do have actually a
Yes.
service called Pharmacy First, no pun intended, and these will actually be how we will help you treat
Yeah.
cystitis. I think that's very, very important to mention.
Important. Yeah. Brilliant. So, what is your take-home message for today's episode?
Yeah, so we've mentioned quite a bit when it comes to cystitis. As we've said, it is not a very serious condition, but it is common. And because of how common it is, some people might end up ignoring it, and which is the worst you can do for yourself.
Yeah.
So recognizing the symptoms early and
Yep.
understanding triggers will make all the difference to treating
Yeah.
cystitis. And with the right care, prevention, and even some love for your bladder. So all the things we've mentioned, which is when you need to go pee, go pee.
Yes.
If you're not drinking enough water, make sure you're drinking enough
Yeah.
water. Make sure you're urinating enough as well when you have cystitis. These are some
Yeah.
of the things that you can actually implement in your day-to-day just to help prevent cystitis
Yeah.
or even help treat cystitis.
Mm.
Also speak to a professional if you're not sure what exactly is
Yeah.
going on, because sometimes what happens is with certain conditions you have symptoms that will mimic other conditions. So just because we have said these are symptoms of cystitis doesn't necessarily mean that this is all there is to do with cystitis, or
Yeah.
any other symptoms won't necessarily mean cystitis, or these symptoms won't mean something else. So when you're not sure, speak to a healthcare professional, speak to your doctors, come to us, speak to us about your symptoms, speak to us about whatever's going on, and we will help try and find, the way forward. But cystitis is not an STI. It might be embarrassing because of how frequent you might be going to the toilet, but it shouldn't be. There is treatment for cystitis, but with the right care, with the right information, and also with the right treatment, you can definitely treat cystitis. What is your
Fantastic.
take-home message when it comes to cystitis?
That was brilliant. I think you've said it all, so I'm just gonna keep it brief.
Yeah.
As you already mentioned, cystitis is a very common bacterial infection. It is
Yeah.
uncomfortable, as we've mentioned, but it's totally manageable. So the most important thing is please know the signs, as we've mentioned. Don't
Yes.
ignore the symptoms, please, and prioritize hydration, hygiene, and speaking up when something feels off. It's so important that we speak up, because most of the times we like to think, oh, we've got it under control, but please make sure
Yeah.
that you do speak up if you need to. Acting fast, which Trudy has already mentioned, is really important when it comes to cystitis, because the faster you act, the better it is in preventing you from getting like different complications. So please, please,
Yeah.
please act fast. Your bladder health matters, and the more you understand it, the better you can take care of yourself. So please, if you
Yeah.
enjoyed this episode, like it, follow us, leave us a comment. If you're watching, please do subscribe and send it to your friends, send it to your family. But thank you so much for watching. See you next time.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.